Hi, I'm Dr. JJ Wicker.
And I'm Dr. Lindsay Tuba.
Today we are going to be talking about mild hearing loss and can something be done, which is kind of, I don't know if controversial is the right word.
It's definitely a hot topic.
It's a hot topic, and especially when it comes to people who aren't audiologists. But before we get there, we'd like to invite you to please like and subscribe to our page and click the notification bell so that as our content comes out, you'll be notified and you can share it with the world. So, mild hearing loss. So let's start with kind of what is mild hearing loss?
Okay, well, that even in and of itself is a little bit of a controversial topic amongst audiologists and
even
physicians.
Pediatric audiologists.
So you've got, hearing loss is categorized, thank you, in slight, so you've got normal hearing, slight hearing loss, mild hearing loss, moderately severe, profound. Did I miss any?
Those are definitely all the ones talked about.
Yeah.
And I think that's where the conversation comes into play is because, there are those people who don't think slight is a thing, and they just bypass that altogether. It's normal and then mild.
Yeah, I think that's I think that's one of the things talked a lot about within the pediatric audiology world, is what should we do if a child has slight or mild hearing loss, and different audiologists believe different things, and you may hear something from your school audiologist versus one of us. But what we're finding is so many children who, people my age, in fact this happened just recently, somebody my age who was diagnosed with mild hearing loss with a comorbid disorder. She was never fit with hearing aids, and now 30 years has passed and her hearing ability has decreased, but also because she wasn't fit with hearing aids for that mild hearing loss or treated in any other way for that mild hearing loss, that functioning in her brain, the understanding part of her brain, has also deteriorated because she was never fit or treated for that mild hearing loss.
Yeah.
So.
And I think the big question that's for why this is a hot topic is when we're talking about mild or slight hearing loss, what is it impacting, if anything? But then also, the other thing that comes to my mind is what is rehab going to look like if they're living with this slight mild hearing loss for 30 years? Your friends, what are the implications long term, even if it stays mild and doesn't, progress?
Right.
What if it stays mild, and what's going to happen? Maybe they do fine when they're younger and they're in more controlled environments, but then they go into the workplace, and how does that change for them? So I think that's part of why some people are kind of let's not treat it, let's wait and see. And that's where I think we have our issue.
And let's just talk about that, the whole wait and see approach. And this applies to a lot of different things. Fluid in the ears, sometimes they'll say, let's wait and see. But it definitely happens with slight or mild hearing loss. Let's wait and see. I'm very anti let's wait and see approach, because why do we want to wait until something has become a problem for a child before we do anything for it? Let's tackle this in the beginning so that it doesn't become a problem, because by the time it's a problem, and then you're backtracking. And our goal is for kids to get the information they need, get the knowledge they need, and not have to struggle. Because one thing that can happen, that I've seen happen in children who have had mild hearing loss, and sometimes parents don't even know they have mild hearing loss for quite some time, because the child is very smart, they've done a very good job of compensating, but they come home just absolutely exhausted because their whole day is this trying to hyper focus on sound, and what was the teacher saying, what are my parents saying, and really using so much of their brain power and so much of their energy trying to compensate for this mild hearing loss. So it may seem their grades are great, it may seem like they're doing great, but they are just exhausted, mentally, physically, their soul.
And I feel, I feel like that perception piece is huge, because again, with slight mild hearing loss, you can very much seem like you're just fine, even in infants, you know, like, oh, my baby is hearing my voice, my baby is startling to loud sounds. It seems like there's this kind of public perception that to need intervention to need intervention for your hearing, you need to be someone who is non-responsive to sounds, or you need to be someone who doesn't startle, for whom you need to shout, you know. I feel like that's the perception of what hearing loss looks like. And so that's how mild hearing loss has kind of been put on this back burner, because people are like, well, you know, he hears me when I call him, and that's all that matters. But really, when it comes to hearing, it's not just that you can detect sound, it's about the clarity of the sound. And when you start talking about hearing loss, the clarity is what's being compromised. Is, you know, maybe they can hear your voice, but especially when you're in a noisy or a reverberant place, how much are they able to understand, even if they're able to detect what you're saying?
Yeah, and mild hearing loss is very easily treatable. Not necessarily reversible, but definitely treatable. And we're very, JJ and I both take more of a proactive approach to treatment, where we don't want to, again, wait until something's a problem. Let's treat it right from the beginning, so that your child doesn't have to struggle, so that they don't have to come home exhausted from working so hard to, you know, to compensate for this. It really is important to take these things into consideration when you're determining, should I treat my child, and especially if you've heard different recommendations. Say you've seen 2 different audiologists, you get 2 different recommendations, or you see a physician and they say, well, it's mild, versus a physician that says, hearing loss, let's do something, and you will get all sorts.
When it comes to physicians, especially, we're talking ENTs, usually ear, nose, and throat physicians, and I think that's why it's important to find an ear, nose, and throat physician who likes the ears. I've noticed that, because there are some ear, nose, and throat physicians who are great and a lot more passionate about working with nose and throat issues. But then there are those ear, nose, and throat physicians who are really into ears and hearing, and those are usually the ones who seem to be a lot more on board with, like, let's do something.
And just to pull in pediatricians to that conversation a little bit, it's not uncommon for parents to come in, and I know not every pediatrician is like this. I think there are definitely some that are tremendous, that say, if there's any hearing loss whatsoever, let's go for this, let's get this taken care of. But on the other end of the spectrum, you may have gotten a hearing test from an audiologist, and there's been a mild hearing loss, and they've recommended going ahead and treating that with hearing aids, amplification, or even like an assistive listening device, depending on the age of the child. But then when you go back to the pediatrician says, well, it's mild, let's just wait and see. So this kind of circles back around to this sort of vortex, what we call, of this let's wait and see. So if you are somebody who's taken your child to a pediatrician and they've said this, or to an ENT and they've said that, it's okay to challenge them, you know, or an audiologist, challenge them. Say, well, why do you think that that's okay? And on the other end of the spectrum, if you feel that an audiologist is being too proactive, say why. You know, question the recommendations that you get. I'm happy when a parent feels comfortable enough to say, why do you think this is so important now? Because, as you likely already know, I'm happy to talk about my opinion, and and I'm very passionate about my opinion, and because it affects your child's life, their whole life. What happens in a child's young years is going to affect the rest of their entire life, and that's why we're so passionate about early detection, early intervention, and being quite aggressive in the intervention that we offer, because we don't want to miss out on that opportunity of those crucial years.
I echo everything that she's saying, and I think just for the sake of clarity, in this clinic we do treat, we do go after fitting hearing aids and mild hearing loss.
Absolutely.
Just in case that wasn't clear. And again, we're not to downplay other people who maybe make different choices, but I think that the point of this hot topic was to say mild hearing loss can impact you, and that's why.
Great. I'm sure this has brought up some questions in some of you, especially if you have a child with mild hearing loss. So please be sure to ask those questions. Reach out to us, comment below, and we will address your questions. we may even need to make another video regarding it, depending on the questions that we receive, and we're happy to do so because we're always here to support you as parents, caregivers, family members, loved ones who have a child who may have a mild hearing loss, or even an adult who has a mild hearing loss. So
different
this is
topic, but yes.
different topic, but we still feel the same needs to be treated. So so that's it for today.
Yeah.
Be sure that you subscribe, like us, click that little notification, and
notice our link is at the bottom of the screen for our website, so please give us a visit.
Yeah.
Hope you have a good day.
Bye, everyone.